Hello, and welcome to this series called I'm Pregnant, Now What? This is a series that I have created to help empower you to navigate the system. So, for those who don't know me, my name is Alicia. I am the podcast host of the podcast Cuppa with a doula. I am an exercise physiologist, I am a doula, and I am a mom to two. The idea for this series came from doing my podcast and realizing that a lot of first-time moms actually had no idea about their options. They didn't know what they didn't know, and it was hard for them to get answers to questions they didn't know they had. So the aim with this series is to target mums to be and women who might be trying to conceive or thinking of conceiving soon, and try and piece together information about how to navigate the system. So this series is mostly aimed at women that will be birthing within a hospital, whether it's a private or a public hospital. But a lot of the information I do share can actually still be applied to another model of care like home birth or even free birthing. And so the aim of this series is essentially to help you to identify what birthing options are available to you. Learn how to question whether it's in your pregnancy or, for your general health, learning to question your healthcare providers, learning to say no if there are things that you don't want to do or it doesn't align with you. Learning that pregnancies, babies come in different sizes and shapes and things might look different, but it doesn't mean it's abnormal. Also, potential questions that you might want to ask your healthcare provider. So in this series, I'm trying to explore those topics and really give you the keys so that you have the knowledge and you can make decisions. You are in control, you have knowledge, you are in charge of your pregnancy, of your decisions, and you can make the most informed decisions because you know where you're going, you know what's coming, and you know what to ask. So if you know anyone who's pregnant, if you're trying to conceive, if you're pregnant right now, please share this with your mum friends, share this with your pregnancy buddies, share this with anyone you know who might be trying. Please share it so that I can help as many mums out there, as many mums to be, to have an empowered pregnancy, labor, and postpartum. Thank you so much for sharing the word out there. If you want to check out my podcast, I have put the links in the show notes. The name is Cuppa with a doula. It's available on most podcast listening platform. It's available on this channel on YouTube, and you can actually watch the recordings with my guests instead of just having the audio. And please share the podcast as well. Every week I have a mom or a mom-to-be that comes and shares their story of pregnancy, birth, and parenting. And every month I have a health professional come on the podcast and chat about their area of expertise. So there is a lot happening on the podcast. There is already a lot of birth stories and professional interviews out there. So do check it out. Do share it. Spread the word. Do tell your friends about it. I'd really appreciate it. This podcast and this series is only able to exist because of you. So thank you so much for watching it, and I hope you enjoy it. Thank you. Hello, and welcome back to this series. So in this series, what I'm doing is I'm trying to do some little informative videos for you to navigate the system. So to help you to have all the information, have the knowledge, because we know that knowledge is power, and I want you to be in control. I want you to have the power in your hands. It is you and your partner who can make decisions about your pregnancy, the birth, and your parenting journey. So I want you to have all the keys so that you can navigate the system from the get-go, from the time you find out that you're pregnant, so that you know exactly where you're going. You're not going in blind. You're not relying on anyone giving you the keys because, well, what happens if they don't? You just there'll be a lot of things you won't know that are available to you or that are options. So I want you to have those keys from the get-go. So in this episode, what I want to talk about is something that I've heard in my most recent pregnancy, actually, and it made me reflect a lot on the whole hospital system. So what I want to talk about is the variation of normal. Now, for a little bit of context, so when I was pregnant with my second, I had a student midwife and she was amazing. She was great. And you could tell that she was really passionate about her studies. She's going to make a great midwife one day when she graduates. It's going to be amazing. She would say things to me. So for context, my baby was breech at 34 weeks, which was totally unexpected, and then was going to change the whole trajectory of the birth, basically. But my student midwife kept saying, oh, it's a variation of normal, which she is right, because back in the days, and I might do an episode on that because I did a lot of research about breech. So back in the days, there used to be a lot more breech babies born vaginally because, well, it was a variation of normal. We know that all babies are different. We know that everyone, as an adult, as a kid, everyone is different, right? But everyone is normal. So it's a variation of normal. If you think about normal, well, what does it mean, right? What does it mean to be normal, or to have a normal height child, or to have a normal weight, or to be a normal size? It's a spectrum. We all come in different sizes, different shapes, and we're all normal. So yeah, when I thought about it, I thought, well, yeah, that makes sense, because normal is a spectrum. It's not one thing is normal and everything else is abnormal. It's normal takes a different form. And so back in the days when women had breech babies, they sometimes they birthed their baby vaginally. And there used to be a lot more trained professionals, midwives and obstetrician, that were able to, I don't like to say handle, so I'll put it in, inverted commas there. There used to be a lot more professionals that were trained in breech birth and therefore were confident in their skills, and they were confident that they could assist a woman to birth her baby breech. And nowadays, and I might go into a whole new video about it, but basically in the year 2000, there was a study that came out which basically showed that breech birth was unsafe. And this study was a really, really big one, but it was found later on that the way that they collected the results and the way they analyzed it, they actually didn't do it the best way they could. And so therefore it was found that those results actually that where they said, breech birth was unsafe, it couldn't actually be, they couldn't extrapolate and make that type of conclusion based on their result and the way that they collected those results. But the problem was that because this study had been out for already years, and basically it had been read by a lot of people in the medical field, the damage was done. So a lot of professionals and a lot of hospitals and so on, they just crossed out breech birth from their list of potential birthing options. And so therefore, with that came the lack of skills. So therefore, new medical professionals, so midwives and obstetricians, were not trained in breech birth anymore. And then the ones that were they were told not to assist in breech birthing, so therefore they also lost their skills. So nowadays, it seems like, if just to put it in perspective, it seems like breech birth is not normal. So when I looked into the stats, 99% of babies that are breech at term, or past the due date or so on, are born via C-section, and there's only 1% of all of those breech babies that are born vaginally. So it really puts into perspective that if you have a breech baby and you want to birth vaginally, like I did, because I would have fought the system and I would have done things my way and I would have told them how it was going to be. If that's you, you're in the minority, which makes it not look normal. It does not. And it makes your battle. It makes you trying to basically get the birth you want and birth your baby the way you want really, really difficult. So the whole reason why I'm doing this video is so that in your pregnancy, no matter what happens, no matter what it is, whether it's, you get into your third trimester and maybe you do a scan and the scan shows that maybe baby is on the bigger side, well, there might be a lot of fear-inducing conversations that happen where maybe the obstetrician says, oh, your baby's too big, we'll induce at 38 weeks. And I just want you to know that it's a variation of normal. So, for example, when you're told that your baby's on the bigger side, it's a variation of normal. Babies are born in all sizes and shapes, and some babies are born fairly small. Some babies are born in what is a median weight, and then other babies are born on the bigger side. If you think about it, when you look at a baby's growth chart, so both for height and weight, you've got those percentiles. So they go from basically the first percentile all the way to the 99th percentile. And if you think about what it means for these growth charts, it means that if you take just 50, so 50 is basically the average, right? So it's basically saying that out of all the babies that have been born in the last however many years, 50% were born around this weight. So, being probably, I think the average weight, it depends if you're having a boy or a girl, but we're probably talking about 3 point something kilos, right? And then the other 50%, or, the other, therefore 49%, were born above this weight, and they were anywhere between 3 something and 4+ kilos, right? That's all normal. So when you plot, for example, your baby's height and weight for whatever age they are, and it's showing, for example, your baby's height is in the 60th percentile and your baby's weight is in the 70th, then it's a variation of normal. It's all it means is that your baby's height and weight is above average, and it's basically saying it's your baby's bigger than about 70% of other babies. That's it. But it doesn't matter whether it's the 70th or the 85th percentile, right? Because it's just a number. So I want you to think about it in your pregnancy. When and if there is a time where you are being told that maybe usually baby's weight is on the bigger side, or therefore there needs to be an induction, or there's something like maybe there might be different positioning as well. I want you to think about what it means. And again, remember to ask those questions. I did a whole episode on it, so I don't want to go back to it. But remember to ask those questions and use the BRAIN acronym to really get the full picture of what it means for you at this time, your circumstances. And remember, it is normal for babies to be born at very different weights, and it doesn't necessarily mean that they need to be induced, because I might do a whole episode on what an induction is and what risks and benefits it has. But basically, remember that when we induce a baby, we're obviously creating labor when your body wasn't necessarily going into labor at that time. And so therefore, you are potentially exposing yourself to more risks. And that's why we talk about the cascade of intervention. So therefore, I might do a whole episode on that to really go into depth and talk about what the cascade of intervention is. But basically, to put it in simple terms, the cascade of intervention is from this induction, which is an intervention, there results other interventions because of labor either not beginning, so basically the induction not doing its job, or because the body is not responding well to hormones trying to induce labor, or because it's a really hard labor. So with an induction, it's you get hormones that basically try to recreate the hormones you get in labor, but they're not the same and they don't work the same on the body. And so therefore, it is not the same labor. So from there can result a lot of interventions. So to try and help you to birth your baby when maybe your baby wouldn't have needed help if it wasn't for you being induced. So when you're going through your pregnancy and you're being told about results of scans and you're doing the Doppler checks and and your midwife is doing checking the position of baby, I want you to remember that everything is a variation of normal. So my midwife, my student midwife, also said, and she's fantastic, she also said babies will be born in the position that they need to be born in. And I know a lot of people, it might seem a bit woohoo, but I actually believe in that. I actually believe that babies will be born in the position that is to them the most comfortable. And that's why we know that if, for example, if we go back to a baby being breech, we know that you can do an ECV, which is an extra cephalic version. So it's when an obstetrician will basically try to rotate baby around the 35, 36 week of pregnancy. So they will manually try to rotate baby and basically move its head down. And we know that some ECVs are successful, so to speak, in that they will successfully rotate baby and baby will then be head down. But we know that a large percentage of ECVs are what we call failed. And I don't like to use that term, but basically it means that either the obstetrician managed to move baby's head down, but then baby at a later stage reverted back to being bum down. So therefore, to me, that really shows that babies will just be born in the position that they will need to be born in. And usually, sometimes it's because of something. It could be because of the cord, it could be because of the placenta, it could be because of the length of the cord, it could be because they've got the cord wrapped somewhere around their limbs. Who knows? It could be because of the shape of your pelvis. And all those things are just speculation, and they're really hard to scan for as well. So yeah, I think this episode is about just knowing that everything it's a variation of normal. Everything is just, we all come in different sizes and shapes, and therefore babies do too. And so therefore it's important to remember that if you're being told that, for example, your baby is too big, inverted commas, well, what's too big? What is the definition of too big? Too big for who? Too big for when? And also remember, those growth scans after the third trimester are not accurate. There is a very, very, very large percentage of inaccuracy in those growth scans after the third trimester. So whatever result they give you, if you do a growth scan, do take precautions when you think about what they mean. Because if you're, for example, agreeing to have an induction because of the result of a scan saying your baby's too big, well, what if the baby is actually not too big? Would you still have an induction then? Or are you happy to have an induction regardless of the weight of the baby? Because, well, if the scan is inaccurate and baby's actually an average weight, 50th, 60th percentile, then would you still have an induction then? So those are just things I want you to think about. The power is in your hands. It is you who will be making the decisions for yourself and for your baby. So just think about those and just remember that it's all normal. We all come in different sizes and shapes. So remember to question, remember to ask further questions. So if you're told, oh, we'll just induce at 38 weeks because baby is big, well, maybe that's what you want, but do still ask questions. Do check about, well, what are the benefits of me getting an induction at 38 weeks? What are the risks of me getting an induction at 38 weeks? What other options do I have? What alternatives have I got to this option? What is my gut telling me? Do I want to be induced at 38 weeks? And then my favorite, what happens if I do nothing? What happens if I don't get an induction at 38 weeks? Just ask those, just so you get the full picture. Very important to get the full picture, just so you know everything. You know that potentially, for example, with an induction, even at term, there could be a risk that, for example, baby goes into distress and ends up in the NICU. That's a risk. So it's good to know that it's there. And then you can weigh the pros and the cons. You can weigh it in your circumstances. You can see how it aligns with you, how it's going to look for you and your husband, your partner, and so on, right? So I hope I didn't ramble on too much. I hope this episode actually makes sense. Yeah, on this, I will leave you to it, and I will be back with another episode. If you've been enjoying listening to this content, if you think that it's helpful, that it could help other moms and moms to be out there, please feel free to share it, because the aim with this series is really to reach as many moms to be, as many pregnant women, to basically help them to learn more and to learn how to think differently when they're navigating the system. So this whole series is mostly aimed at women that are going to birth within a hospital. But for example, the art of questioning and so on can be applied to your daily life for sure. But yeah, it's for you to have the keys to navigate the system, to not be blindsided, and to be fully in control of your pregnancy, your birth, and your parenting journey. So if you've been enjoying it, please share it, because it helps me to reach other moms and it helps them to have the keys that they need. Thank you so much for listening, and I will leave you to it. Thank you again.